Airedale General Hospital, in the heart of the Yorkshire countryside, looks like many other National Health Service hospitals across the United Kingdom. But behind these walls, patients are being treated who live hundreds of miles from this part of the north of England. And what's more, they're being treated without even having to leave their own living rooms. It's all part of a groundbreaking experiment in what's called telemedicine. And it's caught the eye of policymakers around the UK as they seek to cope with an enormous rise in demand on the National Health Service at the same time as it faces very constrained budgets.
Have you got any other symptoms? Have you got a temperature, anything like that?
From a room in the hospital, nurses at Airedale communicate directly with patients over the phone, 24 hours a day, 365 days a year. Equipment installed in care homes as far apart as Coventry in the West Midlands and Dartford in the South East, and in the homes of some terminally ill people, allows the sick and anxious to get help and advice whenever they need it.
Well, it allows them to stay in their own home. It gives them a sense of security because it's as if there's somebody there with them all the time, 24-hour access to the service. Sometimes they just want reassurance. Sometimes they're not really sure which way to go, which service to access, whether it be a nurse, a doctor, if they need to come into hospital. So it just gives them that independence and security while they're at home.
The challenges here at Airedale are no different to those the NHS faces across the UK, as it heads for an estimated £30 billion funding gap by around the end of the decade. Contributing to this shortfall are the numbers living longer, many with multiple conditions such as heart disease and diabetes.
It's really about giving the control to the patients.
Bridget Fletcher, the hospital's chief executive, reckons Airedale is showing the way forward by offering support that allows patients to remain in their own homes, reducing expensive hospital admissions. The rest of the NHS should embrace the same approach, she believes.
I think what we're demonstrating here and have been working very hard to be able to develop this kind of system is absolutely what the NHS can and should be doing, because it demonstrates benefit for patients. You know, it's better for the patients at the end of the day. The patients like it, but it's also about using expensive hospital expertise in a more diverse way, in a more distributed way, and we can demonstrate huge resource savings by doing that as well. So I think it's something that the NHS can take on board and can learn from, and I'm sure that, you know, we can use our imagination, and there's lots of different settings where this kind of technology could make a big difference for patients.
Here at Airedale, healthcare is being reimagined for the 21st century. This hospital is not just a building, but a repository of knowledge, and the people inside it can be used in different ways and, crucially, in different locations. And it may just represent the future of the National Health Service. This is Sarah Neville for the Financial Times at Silsden in West Yorkshire.